Hello and welcome to Sista with Dr. Abim. Sista is your number one African women's health and wellness platform where we'll be sharing issues around women's health, covering from puberty to menopause. Yay! Exciting. Today we will be sharing about fibroids because July is Fibroid Awareness Month, and I thought what better way to kick off than to talk about fibroids, because we know that fibroids affect a huge number of us. Up to 6 in 10 people would be affected by fibroids. Yes, so you might know somebody and I might know somebody who's got fibroids. So we'll start off by having a look at what a normal womb looks like. And here is a picture of what a normal womb looks like. And here is a picture of what a fibroid or a womb affected by fibroids look like. And fibroids, what are fibroids? Fibroids are growth within the muscle or sort of the lining of the womb. And we've got different kinds just sort of based on where they are growing on the structure of the womb. What signs might make you wonder about whether or not you've got a fibroid? One of the main or most common signs of a fibroid would be changes in the pattern of your bleeding. So you might get a lot more bleeding than normal. So you're having to use a lot more pads, or you're soaking through your pads, which is not normal for you. Or you're starting to notice that you're getting a bit of a bleed in between your periods. Those are all signs that might make you wonder whether or not you've got a fibroid. Alongside these heavy bleeding, some women would report lots of pain, especially with the period. And we'll just backtrack a bit with the heavy bleeding. And a common cause of the heavy bleeding is because you're getting this increased muscle mass around the lining of your womb, which means that you get a lot more blood supply to that area. So when you do get a period, they tend to be a lot heavier, and because of that increased blood supply, you might get a lot more bleeding than normal. In terms of the lower tummy pains, because of that increased muscle mass as well, with the contraction. So when you have a period, your womb is contracting, trying to get rid of the excess lining of the womb. So with the contraction, some areas of the muscle would have reduced blood supply, and that can cause a lot of pain for some women. And with the kind of fibroid as well, if you do have a fibroid that has a sort of a stalk attached to the connecting the fibroid to or sort of the fibroid has a stalk essentially. A stalk is like a line or like something that sort of the fibroid grows out of. Yes, that's what a stalk is. What that stalk can do sometimes is it can twist on this connection to the womb, which reduces the amount of blood flow to that part of the fibroid, which can cause a lot of pain. So these women would get lots of lower tummy pains, and because of the connection of the nerve fibers in the sort of pelvic area, you might get back pain as well. In terms of other symptoms that you might experience, some women will get things like feeling bloated, and some people would actually even have a bump. If we go back to the photo of the fibroid which I showed you earlier, if you notice there is this fibroid sort of around the top of the womb here, and that can cause that can mimic what somebody would look like if they were pregnant. And also thinking about the pressure from that area, that can sort of push up your bowels or your intestines, which can cause a lot of bloating and trapped wind and just feeling really bloated. And if you think a bit more about that pressure from the top of the womb, it can also cause you to it can slow down how the food passes in your intestine, which can cause a lot of people to feel really constipated. And also, when we think a bit more about the structures around the pelvic area, one of the things that is around the pelvic area is the bladder. And if the fibroid is pushing against the bladder, you might get these urges and need to constantly pee. So that can be a possible symptoms that some women would get. And if you notice that you're getting any of these symptoms, I think a good place to start would be to consult with your doctor, who will then examine you and might have to do an internal exam as well, which might involve them putting their fingers in your vaginal area just to sort of further assess what is going on in the area. They might also have to do a speculum exam, which is a device, a plastic or sometimes a metal device, where they put that into your vaginal area, and what that does for the doctor is for them to be able to have a look at the neck of the womb, called the cervix, because just to better understand what is going on sort of down below. Another thing that would be very useful is an ultrasound scan, which just allows us to understand whether or not you've got some problem. If you've got a fibroid, then they can measure how big that fibroid is and sort of give advice about what is going on with the womb. Based on your symptoms and based on the examination from your doctor and based on the scan findings, your doctor would be able to have a look at all of these things and advise you on what the next best step would be to manage your symptoms. I hope you found this useful. And until next time, this is Sista with Dr. Abem. Take care. Bye.